Red light, you're on.
Okay. Good morning, everyone. We will go ahead and call the meeting of the Tennessee Advisory Commission on Intergovernmental Relations to order. And I'm Larry Waters, and unfortunately, Senator Norris has an illness in the family, is not going to be here today, so I'm going to chair the meeting in his stead and excuse me for any mistakes I made already. I will blame them on Mr. Huffman to my right. But anyway, welcome, and we appreciate you all being here, so we'll go ahead and begin. And if we're on tab 7, and it's Public Chapter 795, and we have a couple of folks that are going to talk to us about it, Mr. Carpenter and Jackie General, is that correct? So,
Mr. Chairman,
yes.
could I interrupt just a minute?
You absolutely can.
We have former Mayor Littlefield from Chattanooga in the audience, and I haven't seen him. He's trying to hide now. He owes me a little money, and he's been trying to hide all morning. But anyway, was a great mayor of Chattanooga and a really great guy to deal with. And I was following him in the hall, and I thought, that guy in front of me looks like Ron Littlefield. So, Mayor, thank you for coming, and glad to have you and good to see you again. He's been enjoying life a little too much since he retired. I haven't seen him. One other comment. We did pass the pilot bill this year. Senator Norris and I did. I think there were 9 amendments made to it. We had a lot of people involved in that bill, and Mayor McDonald literally made a trip up here to help us with it. And if you remember, we agreed that we would run it if there was uniformity of agreement. So every time we got an amendment, I had to send it over to Dr. Lepard and get it sent around. And the whole staff just performed flawlessly in getting that done. That's really my view of what TACIR should do, come up with good ideas and get them implemented. So to the staff and to everyone that worked on it, thank you so much. You did a great job, and that the governor will sign it soon. That'll be behind us. So thank you very much. Just an update.
Thank you, Representative Carter. Appreciate those words. So we'll go ahead and begin now.
Well, thank you, Mr. Chairman and members of the Commission. As the Chairman said, today we're going to be hearing a presentation on Public Chapter 795, Acts of 2017, which directed the Commission to perform a study of the potential overall effects of creating a grant and loan program administered by the Department of Economic and Community Development to encourage the financing and development of food desert relief enterprises that sell fresh food in low-income, underserved areas of the state. Our presenter today is Dr. Jackie General, a population health economist with the Office of Health Policy within the Tennessee Department of Health. Dr. General received her PhD from the Department of Agricultural and Applied Economics at Virginia Tech and studies food access, food deserts, and health outcomes. Prior to her current position with the Tennessee Department of Health, she worked for 2 food banks, one in Vermont and one in Philadelphia. Dr. General prepared a very helpful handout, which you should have in front of you. And I want to thank her again for speaking before the Commission. And if she can come on up, I'll hand it over to her.
Good morning, everyone. Good morning. So I just want to thank the committee for the opportunity to speak with you all today about food deserts, food access, and their relationship to health. Academic research on these topics reaches back to the 1990s, and I hope a quick review of that history will provide some context for the questions you're trying to answer today. So in the 1990s, researchers began observing that an individual's risk of obesity or having a cardiovascular disease varied across neighborhoods. Given that it was already well established that having these conditions were related to the nutritional quality of a person's diet, researchers then began considering the possibility that access to healthy food also varied across neighborhoods. This began the line of literature that was interested in trying to answer the question, do areas of low access exist? By comparing neighborhoods based on the number of supermarkets or the average distance to a supermarket, they found that such areas, which we also know as food deserts, do exist in the United States, and they tended to be in neighborhoods that were of lower income or had a higher prevalence of African American residents. The next step was then to ask, does living in a food desert or having poor access to a supermarket influence an individual's dietary quality and health outcomes? To answer this question, researchers began to shift from measuring neighborhood food access to household food access. The reason for switching from an area-based measure to a household-level measure were related to several concerns developed during that food desert research. First, not all individuals living in a food desert necessarily have low income, and a higher income would likely mitigate the effects of living in a low-access area. Second, some low-income households living in food deserts will have access to a car, which may moderate the influence of living far from a supermarket. Finally, focusing on an area-based measure of access will overlook households living outside of a food desert, which cannot afford healthy food or lack adequate transportation. Shifting from an area-based measure of access to an individual level measure attempts to focus more directly on barriers households may face when trying to obtain healthy food. However, the concerns which were first identified in the food desert literature, that living too far from a supermarket or grocery store would negatively influence dietary and health outcomes, are still reflected in food access studies when access is measured either by accessibility or availability of healthy food retailers. Accessibility is defined by a household's proximity to a healthy food retailer and is generally measured either by a distance to a store or an indicator for living greater than 1 mile from a healthy food retailer in an urban area or greater than 10 miles in a rural area, whereas availability is measured by either the count or density of healthy food retailers within close proximity to a home. The primary goal of food access studies is to estimate a relationship between access and dietary or health outcomes. However, when considering the relationship between accessibility or availability of healthy food retailers and either eating healthy, which is generally measured by fruit and vegetable consumption, or health outcomes, most usually obesity, the evidence is mixed. And that means that while some studies find a significant positive relationship, which would suggest that living further from a supermarket increases the likelihood of obesity, which is consistent with that hypothesis that the local food environment influences health, other studies find a significant negative relationship, which is, of course, counterintuitive, because it would suggest that living further from a supermarket actually is protective of health. And then, of course, some studies will find no relationship at all. These mixed findings suggest that the relationship between healthy food access and health is not consistent and may not be generalizable across a broad population. The reasons for these mixed studies or mixed findings may in part be explained by some of the limitations of these studies. First, food access studies tend to measure the distance from the household to the nearest store rather than a store the household shops at. Even for those studies that measure the distance to a utilized store, they generally lack information on what households purchase. This limitation makes it difficult for researchers to conclude if the relationship captured in this study is related to store utilization or some other household behavior. Second, although barriers to healthy eating may include both distance to the store and ability to afford healthy food, research tends to study these barriers in isolation. Thus, if affordability is a greater barrier and has a greater influence on purchasing behavior, it may help to explain why distance alone appears to have no relationship with health. Finally, it is possible that the distance to a supermarket may also reflect other attributes of a community or household, such as crime or poverty, which may also influence dietary and health outcomes. If researchers do not adequately control for these other influences, they may over or underestimate the influence of supermarket proximity on health outcomes. Finally, most of these studies are designed to assess correlations or associations between distance and health outcomes, but cannot be used to say if the distance caused the health outcome. Building a new supermarket then not only provides an opportunity to test for a relationship between improved access and health outcomes, but it can also be used to evaluate the effectiveness of interventions designed to improve access. To the best of my knowledge, in the United States, 4 such studies exist, which have attempted to evaluate the effect of building a new supermarket on individual level outcomes, and they're listed on page 2 of your handout. These are considered evaluation studies because they measure individual level outcomes before and after a new store opens and compare those changes to changes in a neighborhood which has not received a new supermarket. In the 2 studies, there was a change in dietary outcome, but in one conducted in the Bronx, it was an increase in consumption of total fat and protein-rich foods. And in the second, in Pittsburgh, they were unable to attribute the change they observed to the use of the new supermarket. In the other two studies, consumer behavior was unaffected by the opening of a new supermarket. And in the Flint study, the supermarket eventually closed. One insight gained from these studies, which may help to explain their lack of influence on consumer behavior and some of those mixed findings from food access studies we previously discussed, was that not everyone in the study, all of whom were residents of neighborhoods in which a supermarket was built, used the store. Store utilization ranged from a low of 13% to a high of 68%. This could suggest that distance to a supermarket isn't the only attribute households consider when making their food shopping decisions. So why might this be? Why does it appear that supermarket accessibility or building a new supermarket does not affect consumer behavior? One reason may have to do with the assumptions that these interventions make about consumer behavior and how well or poorly they align with observed consumer behavior. Building a new supermarket changes the amount of time an individual has to travel to a supermarket, but it may not change the prices they have to pay once they get there. If households are more sensitive to the price of food, they may choose not to shop at the new supermarket, or if they do shop at the new supermarket, they may continue to make the same food purchases. Either way, the new supermarket will not influence what they purchase and thus will not affect their health. There is some evidence to suggest that households are willing to travel beyond their nearest supermarket. Using data from the Food Acquisition and Purchase Survey, Food Apps, a USDA report found that the national average straight-line distance to the nearest supermarket was 2.1 miles. But households travel on average 3.8 miles to get to the store they do their usual shopping. And this behavior was consistent regardless of whether they travel by foot, car, bus, bike. Building new supermarkets also assume that households prefer to shop at supermarkets. However, a national survey data from the Food Apps or the Nielsen Home Scan surveys find that households are fairly evenly split between their choice of supermarkets or supercenters for regular grocery shopping. Supercenters would include stores like Walmarts and Walmarts and super Walmarts, which contain both grocery and home goods. Thus, if households have a strong preference for a non-supermarket food retailer, they may be unwilling to change their choice of store, even if a new store is built closer to them. Finally, most households do not rely on a single retailer for all their food purchases. Approximately 40% of household expenditures are spent on food at restaurants and fast food retailers, which also tend to offer food that is of lower nutritional quality and therefore may have greater effect on health. The review of the literature, which suggests that policies and programs designed to improve food access and health may need to address healthy food affordability in addition to supermarket proximity. While I was working at the food bank in Philadelphia, they began a project to open a nonprofit grocery store in a food desert. The goal was not only to decrease the distance households need to travel to the supermarket, but also use the nonprofit management structure to keep prices low. The grocery store opened after I finished working there and is still open to this day. Alternatively, programs designed to address accessibility only may have to be more targeted to reach those individuals most in need, in particular those individuals who do not have access to a vehicle. The USDA started a pilot program in 2017 to allow SNAP participants in some states and at some stores to use their SNAP benefits to make purchases online. Although they cannot use their benefits to pay for the price of delivery, programs that subsidize home delivery of groceries may be an alternative to building new retailers. Regardless of the program or policies designs, we still have much to learn about how to design programs which effectively improve dietary quality amongst low-income, low-access households. And evaluating such programs would be an important part of any policy. So that's all the prepared testimony I have for today. If you have any questions, please feel free to ask.
Thank you, Mr. Chairman. In Memphis recently, in an area that is considered underserved, minority population, impoverished, Kroger had a store there a number of years, and they closed after losing $1 million. So I was interested in a lot of what you said, and I wondered even the comparison between the urban and the rural. In Tennessee, we have the Appalachian area with high poverty, and then we have the urban area in Memphis particularly that is impoverished, 25% or so, that would be in that classification. So you said 10 miles in a rural area. I guess that assumes they all have some kind of transportation that they can get to.
So that distance assumption was made just in general. It's kind of one that stuck around for a while. It wasn't like someone estimated and said, oh, if you live 10 miles, then suddenly your behavior changes. But yeah, we do generally assume that in rural areas, the distance is longer because we do assume they have greater access to a vehicle. And so if you look at some of the census surveys, you know, car ownership, particularly in rural areas, is upwards of over 80%. So which is to say why when we look at addressing access alone in some of these evaluations or in programs, we do want to focus on those individuals that lack access to a vehicle.
And then the nonprofit food store that you mentioned that you had worked with, who ran it, who organized it, who ran it, and who is running it?
So the food bank that I worked with is called Fill Abundance, and they raise the funds to open the store, they manage the store. And because they're a nonprofit and they run the grocery store as a nonprofit, they're not worried about making a profit. So they're able to keep their prices low, and they also are able to use it as a point of distribution for their free products.
So does that serve as a food bank also as well as a food store?
Its primary purpose is to serve as a food store. They offer some free products to households that would qualify to use their food bank products, but most of the products there are for sale.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. You use the term healthy food retailer. Tell me what that is.
So a healthy food retailer generally implies or refers to a supermarket or a supercenter or a grocery store, somewhere where people are more likely to be able to purchase fruits and vegetables. Generally, we wouldn't consider a convenience store or a corner store or a gas station to be a healthy food retailer. But it's one of those terms that doesn't always have a fixed definition. But generally, yes, supermarkets, superstore, places where you're more likely to be able to purchase fresh fruits and vegetables.
If you walk down the streets of most boroughs of New York City, about every 3 blocks you'll see a store that has an array of vegetables and fruits out where people can walk in and buy the fresh fruits and the vegetables that most of us, and I think you would say, are components of a healthy diet. Why don't, if we see that in places like New York City and Washington, D.C. and other cities, why don't we have that in the areas that are food deserts in Tennessee?
So the first thing to think about is somewhere like New York City is an extremely population-dense area. So they're just going to find more food retailers there because you're going to need more to serve that population. You can also think of the design of New York City. Again, it's a very densely packed area. And when you think about other places like Nashville or Tennessee, where it's not as densely populated, what we've seen since the 1960s has been a preference for food retailers to kind of move out of those urban areas so that they can open larger stores. And they want to open these larger stores kind of outside the city centers because they can then offer lower prices. And so consumers have responded to that. And they have over time shifted in a lot of places like Tennessee where there is higher car ownership. They've shifted to wanting to drive to stores where they can receive a lower price rather than shopping at some of these small corner stores. I think New York is a very, I don't want to say special, it's unique because it is an extremely dense urban center. You don't see that kind of density replicated in a lot of other cities. So where stores locate or how they've changed over time is in part a response to what consumers want. And consumers wanted lower prices.
So getting back to what consumers want, I come from a part of Tennessee, East Tennessee that's not nearly as dense as New York. And we can go visit with people that will have big gardens and they'll have a cupboard full of beans and other things that they preserved right beside bags of potato chips. You know, for breakfast, they fry their bacon in a skillet and pop the eggs in there. They have their toast and they put butter on. So they have access to fruits and vegetables, but their behavior is such that they eat what they want to eat that tastes good. And so is the issue, is the issue one of access, or is it an issue that we need to be focusing on changing behavior?
So the answer is probably both, and it depends on what population you are interested in helping. So for some households, right, access is going to be their greatest issue. So I'll back up just for a second. So as an economist, we think about choices as being some intersection between preferences and constraints. There are those things that I want to purchase based on what my preferences are. And then there are those things I can purchase based on how much money I have or how much time I have available to travel to a store and to cook foods. So for some individuals, you know, their preferences, they may be able to express those preferences, and they may not face any barriers. And so they can make eggs and bacon in the morning, and that's fine for them, and that's what their choice is. Some households won't have that choice. They'll eat eggs and bacon in the morning or peanut butter and jelly sandwiches, even though they would prefer to have a salad or a fruit salad because they don't have enough money. So part of the challenge with deriving or implementing these programs is that not all households face the same constraints. And so it's a matter of trying to find those households that are most in need and addressing their needs so that everyone has the opportunity to make healthy choices.
Have any of the cities looked at, in a lot of places they have farmers markets these days. Even in New York, you can walk down the street and every 5 or 6 blocks on certain days of the week, there'll be farmers markets. Have there been any studies that look at, instead of focusing on trying to bring a new business, right, which involves incredible capital costs and other things in places, capital at risk if it doesn't work. Simply, you know, let's work with our farmers. Let's encourage the agricultural side to produce more fruits and vegetables, and then on the state side, whether we you know, however we do it, we try to get those fruits and vegetables and healthy foods in the food deserts at a price, even if it must be free, that these families where they can take advantage of it. You know, I know there's some focus on trying to get the stores there. I know we help people with assistance that are needed for food and nutrition, but would one of the solutions be to simply work with our farmers to try to generate more fruits and vegetables and the healthy foods you talk about, and then let's distribute them in the areas where they're needed, as opposed to focusing on the economic cost of trying to recruit or build a new business?
I think that's certainly one possible alternative. So some of the state-level healthy food financing initiatives have allowed their grant money to be used to improve services at either small retailers, so helping them to bring more fruits and vegetables into their store, or providing refrigeration or other kind of amenities to a farmer's markets to help them improve what they are able to offer to individuals. I have to say, I haven't seen any evaluations of those programs to say whether or not they perform better or worse than opening a new supermarket, but there's definitely interest, and people are working on trying to improve access by increasing farmers markets and also increasing the affordability of farmers markets. So there have been some states that have provided coupons and matching dollars to SNAP participants. So when you go to if you're a SNAP participant and you go to your local farmer's market, they may match you dollar for dollar on what you spend. So if you spend $5 on tomatoes, you get $5 to spend on another product. And that might be helpful because that then would address both that accessibility and affordability.
One more question. I apologize for having so many questions, but this is an important area, and I appreciate the work that you're doing. Have there been any studies that have looked at the health cost savings when you have healthier children with healthier diets versus those that don't? And the example I will give you is fluoride. Right. They've studied the communities that have fluoride in the water, and they know that those children end up having much fewer health care issues, and they can document the billions of dollars in future health care costs that are saved because we invest in fluoridated water and thus the health care benefits that flow from it. Have there been studies that have documented the savings in healthcare, for example, that a state like Tennessee would save over the next 20, 30, 40 years if we simply got healthier children today?
I'm not aware of such a study. It's something I could look into further if you'd be interested. I would say one of the challenges of conducting a study like that would be having access to data for a child over a long period of time. So you would want to know, what did the child eat when they were younger and measure their health outcomes when they're adult. And those kinds of studies are very difficult to do because we just don't have access to that kind of data. But I could look for studies that have tried to look at just the differences between children in a shorter time frame. But, establishing healthy eating habits as a child obviously has some appeal because you would hope they carry those through into adulthood, which is when they develop those costly chronic diseases.
So you would expect that the state would see a return on its investment in this area in the decades to come simply in the savings of healthcare costs because people start life healthier and hopefully they will keep those good habits as they age.
If you could change their behaviors as children and they maintain those behaviors into adulthood, then yes, I would hope so. But I don't have any studies that have shown that yet.
Thank you for your presentation today.
Thank you for being here today. And this obviously is an important topic. We spend lots of time at the legislature every year dealing with the fact that Tennessee has health statistics on any number of measures that are troubling, and most if not all of which are at least part and related to diet. I'm wondering about two different things here when it comes to access. I guess the first is there any research or data about sort of availability and access shaping preferences in terms of whether, if all that's on your street is the corner store, does that lead to people, having, even when they move to a place that does have access, shaping their preferences for types of food? Mm-hmm. And the second question is kind of speaking to the, just having a grocery store aspect. Similar to when we were talking about broadband, it's one thing to make a resource available. It's a whole other thing to see it adopted and used. And just personally, so like my wife and I got the food box before we had children, and it would come each month or each 2 weeks, and we would have to spend time on the internet just to figure out what vegetables had arrived, much less what to do with them. And I sort of wonder whether, how do you actually, get from step one of actually having food, at an economically available, you can get to it, but how do you deal with the constraints that people don't know what to do with, especially, some other of the more economically affordable foods that are healthy that are out there.
Mm-hmm. So to address your first question, does kind of availability shape our choice of where to shop? I will say that there is pretty good evidence that people have a very, very strong preference for grocery stores. So supermarkets, so large supermarkets. So even when you live in a low access area, people tend to do what they can to get to a supermarket on average once a week. Where I think that we've seen more about food availability shaping where we make choices about where to shop, there have been studies that have kind of looked at, yes, the number of stores in your area, does that influence which store you choose to shop to? There is some association there. So, I'm sorry, I'm trying to think back to exactly what the study was saying, but I'll say this, in general, patterns are people prefer to shop at these supermarkets and they go out of their way. They try very, very hard to get to them. So individuals who live in lower access areas, we do see that, in the week, they also tend to use those groceries or the corner stores and convenience stores slightly more frequently than you would see in a non-low access area. Individuals who are wealthier and live in good access areas tend to then just use their supermarkets slightly more frequently. Those upper income households also tend to eat out a lot more than kind of our lower income, low access households. And then your second question about the time. So a lot of times I haven't seen studies that have tried to deal with that directly. It is an issue that we know is a challenge for households, right? You have the time cost not only of going to the store, purchasing the food, and preparing the food, and what to know to do about it. So when people are trying to adjust that kind of piece of the puzzle, they tend to focus on educational campaigns. So when you buy something, it will come with a recipe or directions. And I haven't seen as many studies that have tried to develop interventions to address that time cost. I will say that when we look at how much time people spend preparing food, on average, you do see that lower income households do spend more time preparing their food because they are probably relying a little bit more heavily on supermarkets and those kinds of places. But it's certainly an issue, yeah.
Listening to your comments, it comes to mind that the health department has, through its local health departments in every community in the state, has a area for basis for outreach there. And I'm wondering, what does our local health departments do with regards to education on food choices, nutritious foods? I'm sure they must be doing something, and then it just seems to me we have some structure in place that we might be able to get into some of the communities for education. And we also see with regard to Senator Yarborough's comment about data or research, the local health department will see a lot of these younger children through the immunization programs. And I would say that not entirely, but many of the clients at the health department would probably fall into the low to moderate income, although not all. So I'm wondering, what role does the health department play in this issue?
And so I certainly think this issue of healthy eating and good access is of concern to the health department. We do have an Office of Primary Prevention, and so increasing access, eating healthily is considered a primary prevention because it can help prevent diseases from occurring in the first place. And in that Office of Primary Prevention, we have healthy development coordinators in different regions throughout the state. And their job is to do outreach to help with educational campaigns to change these kind of behaviors. But some of these interventions are expensive. So I think that they would certainly love to do more. They may just be constrained by the resources they have available and what they do. So we also hand out grants for healthy development. Those tend to be used for building parks to help with physical activity. Physical activity is another piece of the equation when we look at healthy outcomes. But it's definitely of concern to the health department. I think we just might be constrained by resources.
Elaborate on grants. Grants to local governments, nonprofits?
Mm-hmm. Yeah, I think so. This is a little bit outside of my area of direct work. Sure. So if you want, I could put you in contact with our officer, director of that office. But yeah, so they hand them out to schools, local governments. I know they've gone to help build walking tracks and to install water, the kind of water fountains in schools that help refill the Nalgene's and whatnot. Mm-hmm. So yeah, we've seen them use it a bunch of different ways.
Thank you, Mr. Chairman.
Mm-hmm. Representative Love. Thank you, Mr. Chairman, and thank you for
Mm-hmm.
the presentation. I actually first got exposed to the conversation about food deserts through students at Meharry Medical College doing research and had not ever heard of what was going on. And I was glad that they brought that to my attention, which is what kind of sparked myself and Senator Norris proposing this bill a few years back. I wanted to ask this question. We talk about food deserts and grocery stores coming into certain parts of our state where there's low access to it. What role does a food swamp play in not incentivizing that corner store from offering fresh fruits and vegetables? You know, because if I have a store that has less than, let's say, healthy food, if it's no fresh fruits and vegetables, and I have a constant stream of customers coming in there, if the people are buying the foods that can't be cooked, you know, the food's already prepared in bags and in bottles, you know, potato chips and candy and other things. What role does having a food swamp like that play in de-incentivizing that same store from saying, I'm going to put some fresh fruits and vegetables over here in my store, or some fresh meat?
Mm-hmm. So this concept of food swamp, which, and just so everyone is on the same page, we generally define as kind of areas that have more than expected number of fast food restaurants, corner stores, those kinds of retailers. And I think one thing to remember about what choices that these retailers make about what to put on their shelves has to do with a little bit of their competition. So these retailers know that households tend to prefer to go to supermarkets to shop. And so they may be wary of placing those kinds of foods in their stores because they are perishable. Yeah. So they have to sell in a short period of time. And households don't frequent corner stores and convenience stores as much as I think we think they do. So kind of on average from this food app study, we find that it's 2 times a week. So it's not very much. So there are programs, right, that have tried to help retailers kind of overcome some of these challenges, which may not only be the fear of making a loss on those products, but also just the storage required to have perishables. So, you know, to have a store that carries perishables, you may need refrigeration. And they may have refrigeration space, but it's currently taken up with other products, and they need more. So we have seen interventions which have tried to help consumers that way. I don't know if being located in a food swamp influences those retailers' decisions any more than it does regardless of where they're located. You know, I think they're kind of looking at their full retailer landscape and making those decisions about what is going to sell, what their consumers want. And there's also kind of that fear of the unknown. And I think that's what, when people are addressing what those kinds of stores sell, that's kind of the barrier that they're focusing on the most. It's just trying to work with these stores to show them if you do sell these products, people will purchase them.
Okay, thank you. And I'm going to piggyback on something Senator Yarborough mentioned earlier. Is it possible to utilize our 2 land grants here in Tennessee, UT Knoxville and Tennessee State University, with their agriculture extension program, since I think they reach all 95 counties, to get to a place where we are able to conduct cooking demonstrations and go into areas where people may not be familiar with how to prepare these meals, and provide those trainings at either low or no cost to persons, because it doesn't do any good to have a grocery store or a convenience store start offering fresh fruits and vegetables, and then persons just don't know how to prepare those meals. Is it possible to use that resource?
I think you would need to speak with them further. I do know that the agricultural extension does address some of those issues, and then also, I believe when you receive WIC, you may also receive some nutritional education along with that. Sometimes the challenge, though, with focusing on education alone is that it still doesn't address this affordability issue. So I may know how to cook an apple 15 different ways, but if I can't afford it, right, it's not going to happen. So a lot of times when we look at these interventions, there might be kind of a joint component. Maybe you offer a cooking program and coupons, or offer a cooking. I've also seen where they offer cooking programs, and then you take home the ingredients to make that product at home. But thinking kind of about those long-term sustainable impacts or changes, a lot of times the education is the one-off, and you know, thinking about how to change that retailer environment to support healthy food choices.
Okay, and finally, there was a program a few years back here in Nashville that they tried to start and did not get much traction. I think it was called Share a Share, where they encouraged farmers to grow a little bit more than what they were growing to sell immediately, based on the fact that I might buy more than what I need, and I'm going to give the extra to an organization that is going to then go and distribute among those who don't have access, but also don't have the affordability. And several things happened. One, the farmer was able to maybe grow a little bit extra because they knew that someone like myself or someone else was going to go ahead and buy the extra share and pay for it up front. That way they covered their cost. And then that extra share could be given to an organization that was going to distribute to people in urban areas and also in some rural areas. But I know that they had it running for maybe about 6 months to a year, but just could not get up the support for it. So that may be one of the things we look at when we talk about trying to help out farmers, to say, local farmers, if you go just a little bit extra, we have some folks who are going to go ahead and purchase up front to cover your cost, and then we'll distribute that among those who need it. So.
No, I think it's a really interesting idea, and I have to say, when I worked at the food banks, our farmers were an absolutely incredible resource. When I worked in Vermont, they ran a program called a gleaning program. So when farmers felt that they could it was no longer profitable for them to harvest, they would call us and we would come and finish the harvest. We had farmers bring whole pigs to the food bank to redistribute back out. I mean, it's an absolutely incredible community and a great resource.
Okay, thank you.
Okay, further questions? Yes, Representative Carter.
Thank you for your presentation. Are you familiar with a nonprofit called Bueller Brothers?
I'm not, sorry.
Okay, they started the elimination of food deserts about 90 years ago. When Representative Love brought this up to me, I brought up Chattanooga, because you remember Bueller Brothers down on Broad? Were they on Broad or Market? They were there about 90 years, and they closed last month. And they were a religious sect that had nonprofit food stores in food deserts all across the country. I discovered it because my father distributed meat for Armour & Company, and he needed to put up a big sign, and I was 6 years old. I was light enough to walk on the refrigerated counter to hang the sign. And there was an elderly gentleman down there that set me down and told me the mission of Bueller Brothers. I thought it was just wonderful. But it went out of business. And so I called when I saw they were going out of business, told them who I was down there 60 years ago. But I'd like to talk to you about it. They advised me that with the regentrification of Chattanooga and all the homes being torn down and condos being built, that the people moving into town would not shop there, and drove out and bought their foods at other places, Whole Foods right across the river, and specialty stores. And so even at nonprofit, with the building paid for and no taxation, because they were a nonprofit, they just couldn't make it. They had cooking classes. They sold vegetables. They sold fruits. That was their mission. So when I saw them go under, and I told Representative Love about it, we looked into them then to see if they would come to Nashville and do other things like that. It was a real blow to me to think that we had lost them. Another problem they had, it's not a problem, it's a wonderful thing, is that the local churches in Chattanooga have such active food banks where they give away food. It's a little hard to sell it when someone's giving it away. And so all this is very complex. Chattanooga's downtown has changed so radically in 20 years, you wouldn't be able to recognize you're in the same city. So I'm just wondering, are people looking at maybe trucks to bring fruits and vegetables into the areas where they could be? And because if you buy a building with the cost of property downtown, nonprofit is going to be far higher than Walmart or Kroger or one of the other places, I'm afraid. My final comment is, I don't know how providing fruits and vegetables is going to change people's opinions and their attitudes. That's what scares me. We have the the farmers market downtown. I was down there Sunday and had a great time. The food there is so expensive that my wife complained about it. So I don't know how poor people would be able to get in there and buy that. But it's a great farmers market. Many farmers now tell me they're finally making money, and I'm happy about that. But most of these folks, I don't know how we're going to change their attitude and what they cook by making it available If they don't want it, I don't know what price makes it attractive.
So first about the idea of trucks, I believe the Chattanooga Health Department does run a fruit and vegetable truck that travels into these areas of low access and helps to sell fruits and vegetables in those areas. And then kind of this issue, right, there is a trade-off between preferences and cost. You know, you'll certainly find some households that are not going to change their behavior regardless of the price, but you will find some households that will. And so we see that over and over again in some of these economic studies is when we subsidize the cost of fruits and vegetables, people change their behavior and they purchase more. One of the things that I had learned while working at these food banks was that there is a lot of fear when you go to make these purchases as a low-income household. When I purchase food for the week, I need to make sure it's going to last me that whole week, that my children will eat it. And so I may hesitate to buy a fruit or vegetable that I'm not sure they're going to like. But if it was cheaper, it may encourage me to purchase it. So I think, yes, you know, and that's, again, this idea that it's hard to find one intervention or one policy that will meet everyone's needs. But certainly these interventions that address the cost, they do help people. We do see people responding to them.
I appreciate that, and I'm certainly sympathetic to that. Collegedale has just created a community farmers market called the Commons. And Collegedale is a Seventh-day Adventist community, and they have one of the longest lifespans in America. If you study that group, you'll find that their 3 centers have the longest living people in America in it. So that ought to sell itself. One of the things they're going to do is teach people how to cook and how to cook healthy. They're at the farmers market, which I thought was just a jam-up idea. And we have a lot of farmers supporting that. So that's going to be an interesting thing to see how many people adapt to that. But you said fruits and vegetables, if they're cheap enough, they may buy them. And I understand that. But Buell Brothers worked at nonprofit. They were nationwide. They had purchasing ability that a single store wouldn't. If they couldn't price their profit or their product at no profit and make it enough to sell, then you're actually talking about subsidizing, are you not? Be the only way to make it any cheaper.
I'm not sure I understand the question.
Well, how do we make the fruit cheaper than a nonprofit dedicated to it that has over 90 stores nationwide? They're buying in bulk.
Right. And I think, you know, I'm very sorry to hear that they went out of business. And I kind of 2 things came to mind when you were talking about their organization. The first is that you mentioned there was a change in Chattanooga about where people lived. And so
very, very dramatic.
Right. And I think that is a challenge that the food banks and the food assistance community in general has been dealing with, is that as wealthier individuals begin to move back into cities, they're kind of displacing that community most in need back out into the suburbs, where they weren't used to seeing them before. And so everybody is having to shift and change how they distribute their resources. The second is, you know, I did work at a food bank who did try the nonprofit grocery store, and it did work. So not all things will work in all places all the time. So it's going to be a matter of, you know, trying things, monitoring and evaluating and reassessing. But that's not, yeah.
Thank you, and thank you for your efforts.
I would just echo what Judge Carter said about the preparation. I hope that as we look at this item, as the TACIR staff looks at this item, that we will consider that as a part. I don't think it's just about making it available. I think it's also about making it where people know what to do with it. You know, our grandmothers and mothers soaked beans, and you bought them cheap, but you had to soak them overnight, and there are things that you just that's not being handed down. And so the education of how to make that food taste good so that you'll want to eat it is, I think, imperative to the success of getting people to eat healthier foods. So.
The only thing I would add to that is kind of thinking back to how our grandparents cooked is the economic nature of households has changed. We have many households now where both parents work, and many households where there's a single parent and she or he has to work. So the time it takes to cook home-cooked meals, I think, is becoming more of a challenge. So I think education is great. We should always encourage people to learn more how to cook. But I think being sensitive to the fact that it may not be an option for some households. You may have 20 minutes a night to prepare a meal. And so no matter how much you teach them to soak beans or to cook things a long time, they may just not do it. So I think just being sensitive to those changes in household constraints is important for these policies as well.
Well, I'm an old guy, and so we buy these new gadgets, and they sit in the box at the house because the wife thought they might help us. But it's hard to cook for two, so I understand. That's the biggest complaint she has is if I make what we really want to eat, there's going to be too much food, and we'll throw a lot of it away. But I do think there are more and more 10-minute meals. And teaching, it's not just about teaching the old ways, but it has to taste good. And some of it's an acquired taste. But I think we do, somebody said earlier about, what we grow up eating, fried bologna, rag bologna, cheese, hoop cheese, There we go. Everybody's ready to go to lunch now, So I do think there is, probably not a lot of South lovers here, but there are things that some of us grew up eating that we still every once in a while would like to have to eat. So I think teaching and doing it younger so that you do get a taste for it. I mean, my wife won't eat a bean. The texture, 65 years old, and, a bean won't cross those lips. But, just got to teach. We got to teach when they're young, and it's got to taste good to them. Thank you for your work.
If I heard right, my colleague just told his wife's age in public. You may not get a meal at all tonight.
So true.
Okay, further questions? If not, thank you very much. We appreciate your time and appreciate you being here today. Okay, next on the agenda is the consolidation of municipal elections, which is Senate Bill 2146 and House Bill 2265. We have a panel with us, and I'll ask them to come forward. Do what? Okay, yes.
Chairman?
Mr. Mount.
I'm Michael Mount. I'll just quickly introduce the panel. We have with us Mayor Jill Burgeon from Brentwood, Mark Goins, he's the Tennessee Elections Coordinator and of the Office of the Secretary of State, Ron Littlefield, Senior Fellow of the Governing Institute and Lead Analyst in its City Accelerator Initiative and Fellow of the American Institute of Certified Planners, Chris Norman, Administrative Assistant to the Mayor and City Administrator in the City of Dixon. And finally, Philip Warren, behind me. He's the Wilson County Administrator of Elections and President of the Tennessee Association of County Election Officials.
Thank you and welcome. So I guess, who wants to start? Mr. Goins, you look like you're ready.
Well, good morning. Mark Goins, Coordinator of Elections. And, of course, we were made aware of Representative Sexton's bill through communication with him early on. And anyway, we've done some research in preparation for this meeting, surveying the counties. And what we found out is that most counties that have standalone municipal elections have them every 2 years. Some have them every 4. And then in some instances, special elections or whatever the situation may be, there's a few counties it's averaged about every year. We've identified 71 municipalities that have standalone elections impacting 40 counties. Let's look at turnout, because I think turnout is something that you'll see a theme in a moment when we start talking about the surveys and discussing it with the counties. In 2017, so we narrowed down to 2017 and looked at the turnout in standalone elections for municipal elections. It averaged 15%. So when you look at the elections in 2017, 15%. It was a low, less than 1%, up to a high of 45%. The high was a very contested race in Friendship, which is located in Crockett County, Tennessee. 306 voters, possible, 138 voted. So that was 45%. If you look at the low, that would be an unopposed race in Monroe County. In Sweetwater, the city was there. 29,337 potential voters, only 96 voted. Once again, it was an unopposed election. And just for a numbers person, I looked at the lowest number of votes that we had in 2017, and there was actually 5 voters voted in an election, and that was 245 voters potential, and that was Parker's Crossroad in Henderson County. So, and just for when you carry out the numbers even more, when you look at, it was an unopposed election, 5 voters voted, 2 seats to be filled. It cost $900 to hold that election. If you look at turnout, for an August election, and we went back and looked for starting in 2014, trying to get a 4-year election cycle, 28% in August. In November, we had 35%. We had in 2016 a very low turnout, but I think that can be explained. If you look, there wasn't many competitive races on the ballot for August, and the lead race in August of 2016 was property assessor, and that is not a race unless there's property evaluations going out around that time that typically generate a lot of attention, compared to 61% that turned out in November 2016. We don't have the 2018 numbers, and I think that's unfortunate, because I believe that when you look at this August and this November, we are going to have a tremendous turnout. Because when you look at the races that's on the ballot, it's competitive on the Democrat side for governor, it's competitive on the Republican side for governor, and we have a more candidates than I can recall for local offices. Since I've been here, I've been a coordinator since 2009 for August. And then you look at November, we have a competitive Senate race, which we haven't seen since 2008, and then you have some competitive congressional races or some open congressional races to be seen as well. So I certainly expect a larger turnout for 2018. Will that be a trend going forward? I don't know. It's rare that you have a vacant Senate seat and a vacant gubernatorial seat. So this may be an outlier, but I certainly do think that turnout will be high. We surveyed those counties, as I said, and specifically, let me narrow it down to those who have not consolidated yet. So this is what the folks that's in the field have said back that they believe the pros are, and I'll cover the cons as well. Significant cost savings for the municipality. Increased voter turnout. So in other words, if you're consolidating for August and November, they expect cost savings, they expect voter turnout. It will be easier to get poll workers since poll workers are already recruited for the August and November election. More efficient uses of the resources because you're already running the public notices, you're already holding early voting and all those things. We've already taken the steps to conduct an election, training the election officials, those things. And something that I know that Chairman Wergo has spoke about before is the overlapping election dates and deadlines. Sometimes candidates can get confused with different qualifying deadlines for municipalities, because if it's a standalone election, it's different as opposed to combining it. And of course, you have different voter registration dates as well. Now, these are once again counties that have not consolidated. The cons that they looked at, here's some of the cons. Adding the municipal elections to an August or November election could create significantly more ballot types. This is specifically something that you hear from the large counties. A large county that has multiple state representatives, county commission districts, multiple senators, each time you have to break that up, that's a different ballot type. And that may not sound difficult, but once you start looking at early voting and you start having 200, 300 different types of ballots, it can be difficult to make sure that that individual gets the right ballot. And throw in the mix property rights voting. property rights voting can be extremely confusing in that a property rights voter doesn't necessarily have to live in the city. In fact, they don't live in the city. They just own property in the city. So they may live even in a different county, or they may live in that county. So it could be a situation they get a ballot that's outside the county and inside the county, and that can be confusing as well, specifically when you're dealing with more ballot types. Printing costs could be additional, and in some instances, a larger county might have to bring out additional precincts. A more complicated ballot, as I said, could lead more to mistakes, not just from poll workers, but also even the voter. The voter sometimes gets confused and demands a different type ballot because they think they're entitled to it. Increased cost to candidates. Now, it's really kind of out of my purview, but I will tell you that a couple counties presented this to us, and it's something that we hear in our office from time to time as well. Increased cost to candidates because they're out there trying to raise money, and you're competing with other folks that have maybe more name recognition or whatever the case may be. And in turn, what you do with that money, trying to get your message out. And multiple candidates, multiple signs, multiple folks running ads, that could be a problem for individuals. Like I say, once again, it's kind of outside our purview, but it certainly is something that we hear, not on the local level, but also on the state level. An issue that you also see from time to time, and this wouldn't be applicable for everyone, but whether nonpartisan races could suddenly become more partisan. As y'all know, to run for municipality, you can't run partisan elections. But in Davidson County, very specifically, typically on the Democrat side, you're going to have a primary. Republicans had a primary this last May, 0 candidates qualified. So in an instance, now obviously transit was on the ballot, so that probably had cross appeal to every party. But if you have a primary that has no candidates in it, then perhaps the Republicans aren't going to vote. And so in that instance, are they choosing someone specifically, for those municipal races based on partisan means, or vice versa? It could be that someone locks in because they, if you're a Republican in Davidson County, maybe you lock in on certain candidates. So in some instances, in some areas, Williamson County would be just the opposite, a very Republican area where it could be. Now, it may be a wash, frankly, in the end, because if you have a county that's primary Democratic, maybe that's who's going to run. In Williamson County, maybe that's who's going to run there. But anyway, that's something that some counties pointed out. And, of course, another negative was voters could suffer ballot fatigue. You look at the August election, all these different races on the ballot, people could have voter fatigue at the end by the time it got to municipalities. Now, let's look at the folks who have the expertise and have actually done this. So we've identified 23 cities that have consolidated. In 2010, Representative Ramsey, and I forget who the senator was, but they sponsored legislation that allowed cities, it allows, not mandated, and what Representative Sexton's doing would be a mandate, it allowed cities to move. And we've identified 23 cities that have done so. There may be a few more that we're not aware of. In those 23 cities, when we surveyed those administrators, they said, in fact, it did have a significant cost savings. It did increase the participation. And certainly, they felt like they had better, that they were able to recruit poll officials, didn't have to worry about a shortage, and the efficiency in administering that election was, in fact, a lot better. Amazingly, when you look at the folks that were anticipating the cons, they actually did anticipate the cons. Here's the survey, once again, of those who did consolidate. The cons were city candidates can be lost in the mix, specifically in a presidential election where all the focus is on the presidential election. More ballot styles can be confusing. Property rights can become a strong issue. And if the folks who have done it, if they were looking at an election to consolidate as opposed to the August election, which has all those candidates, they certainly would, kind of goes against the presidential thing I just pointed out, but they certainly would recommend the November election because that's typically a very short ballot. And so you're not going to have that ballot fatigue because typically folks are going to be on there. Now let's get to the numbers, and I know my time is low, and so I will conclude with this. We asked those of the 40 counties that currently have standalone elections, we asked the administrators, do you favor consolidation when you look at all the different factors? And as far as administrative standpoint, and there's certainly other factors that come into play, 73% favored, 34 out of 40 responded, 6-9, but 34 out of 40 responded, 73% favorite, 18% did not. Significantly of that 18%, it's your larger counties. And it's more about the ballot style than anything else. They're concerned with all the different ballot styles. The smaller the county, the smaller municipality, mid-sized versus small, then they typically favor it. 10% had no opinion. Less than 10% had no opinion. Anyway, and frankly, from my standpoint, I kind of agree with that. I think once you start looking from an administrative standpoint, I think when you look at the mid-size down to the smaller cities, I think it makes sense as far as turnout and as far as cost efficiency. When you start looking at the larger municipalities, I take caution on whether to actually mandate that on them, because I do think the more ballot styles you get, the more issues you have. And we've had some extremely close elections. I look at Senator Tracy and Scott Desjardins, 80,000 voters, less than 40 votes in that race. And if you start getting the wrong ballot out, in some instances, that could create a new election, which could be very costly. Of course, we would do the best training we could and try to prevent that.
We'll hear from our panelists, and then I'll open it up for questions. So I guess next we have the mayor of Brentwood. Yeah.
Thank you. Thank you, Mr. Chairman and members. I appreciate the chance to speak with you today. As Mr. Goins said, there are more than 70 cities in Tennessee today that have standalone municipal elections. That number includes the 4 largest cities, of course, as well as cities such as Franklin, Jackson, Kingsport, and Brentwood. That list also includes very small cities with fewer than 500 residents. Since state law already allows any city to change its election date to coincide with the general election, the issue now really becomes about local control. Should each city be able to decide for itself what is best when it comes to electing local community leaders? In Brentwood, the majority of our 7-member city commission has never expressed interest in changing our election date. The primary reasons usually discussed in Brentwood and other communities in support of keeping those separate election dates, some have been mentioned already. They do include the idea that local issues would get lost among the county, state, and national general election discussion. And really, it's important, though, because local government issues that are very specific to each area, such as land use, long-range planning, and infrastructure, are the most important in the day-to-day life of residents. Having those standalone local elections allows these important issues to be front and center during that election process. Voters then have the time to focus solely on those issues and educate themselves more about the candidates' positions on those issues. When they're combined with the general election with multiple candidates from multiple offices at multiple levels of government, they simply can be an afterthought to many voters. The cost of being a local candidate could increase because you're competing with more candidates to get voters' attention. And this is an issue at the local level because that's often when first-timers put their foot in the water, basically, to consider serving. Many state and national candidates in general elections can afford television ads, the phone call campaigns, and the things you're familiar with. But local candidates often cannot afford these options when trying to get their name in front of voters. General elections, as has been said, are normally partisan, with candidates running under party affiliation. And with city elections not being partisan, it could add to voter confusion in trying to understand why some candidates are associated with a political party and some are not. And I think that in these days when transparency and clarity is more important probably than ever to voters in terms of elections, I think that's an important point. While a general election date likely would result in greater turnout, the unfortunate reality really for most local elections is that it would not necessarily mean more informed voters on those local issues. Most voters, if being honest, would admit that there have been times that they've walked into a voting booth and encountered candidate names or offices they've never heard of. So we don't believe that that's the best way to elect local government representatives. And cost is a legitimate point for cities on this issue. In Brentwood, the cost of a city election is approximately $40,000. If we moved to a general election date, we would save a portion of that cost, but not all. It obviously varies from city to city based on size. Again, this should be left as a local decision, we feel. For those 70 or so cities that I referred to at the beginning, they have so far decided that the added cost is worth it to them for the value of a standalone election. Other communities that have decided that it's not, and they've already chosen to move their election dates as currently allowed by state law. So really, my point today is that the law allows us to move our local elections if we so choose. Those who believe this is a better plan for their city have already made that choice. Those of us who do not don't want the choice made for us. Thank you.
Thank you. Okay, next, Mr. Littlefield.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. I am a city planner, professional city planner by profession and training, like your consultant, my friend Bill Terry back there lurking in the corner. He and I have been tracking along in this public service environment for most of the last 40 years. From 2005 to 2013, I was the mayor of Chattanooga for 2 terms. If you go back before that, for several years, I served on the city council. And back in the 1980s, when Chattanooga had a commission form of government, which is all elected at large from the city, I was the last elected public works commissioner under that old system of government. And I supported the change from the commission form to the mayor-council form with council members representing specific districts, because I am a believer in representative government, and I am a believer that the best government is the one where the most people participate. And so that's the bias that I come from. In 1993, I ran for mayor. It was my first attempt at that office, and it was an intense election. And in the course of that season of political elections, I had to take my mother to the doctor up in the northern part of the city. Campaign had been going on for quite some time, and took her upstairs, up the elevator to see her doctor, and she was going to be there for a while, so I went back down on the elevator, and it was just me and one other guy on the elevator. And as you will in those occasions, we struck up a little conversation, and we were talking about the weather and what you talk about in those kinds of environments. And when we got down to the bottom floor and the doors opened, he said, "Well, aren't you Ron Littlefield?" And I said, "Yes, sir, I am." And he said, "Well, I know you're running for mayor. I'm planning to vote for you." And I said, "Well, I thank you for that, but the election was last Tuesday." The point of that is, you know, it's easy for elections to get lost under any circumstances. Chattanooga is one of those that is set out by itself. It follows a national election, and I don't know how many times over the course of these decades that I've been following this process, I've heard right after we've elected the president, the mayor and council starts, and people say, "Well, didn't we just have an election? You know, isn't that?" And they even confuse the fact that the signs are out there now. They think the signs are just hangovers from the last election. So getting people back out for an election is, in my opinion, the thing that we need to worry about if we're truly interested in representative government and participation. I had heard the statistics that were just cited here, 15%. I looked at the last city election. It was 17% participation. That's pitiful. That's pathetic. We're nonpartisan. I am a true independent, as Representative Carter would acknowledge. And I really didn't know that this bill was coming up until a reporter called me about it just a few months ago. I didn't have any input in it. My friend Todd Gardenhire and Representative Carter and we don't agree on everything, but and I don't even know, Representative, if you were signed on to this bill, but I truly believe that this is a good move. I'm not concerned. The reporter said, "Well, what about the cost of elections?" I said, "Well, the cost of an election is infinitesimal if you consider the cost of government in general and the cost of operating a city. I'm not worried about that cost. It's small, and it's, in my opinion, even though it's public money, it's insignificant in the discussion that you're having here today. I think the real discussion is participation. And if you are about greater participation, I would say this is the way to go. I'm less worried about voter fatigue when you once have a voter at the ballot box, at the election central or wherever you're holding it, than voter fatigue with them sitting at home watching a football game, not even knowing that an election's going on. And that's, I'm afraid, what happens in far too many cases with municipal elections today.
Okay, thank you. Next, we'll have Mr. Norman.
Thank you, Chairman. My name is Chris Norman. I'm the administrative assistant to the mayor for the city of Dixon. Mayor Don Weiss apologizes for not being able to be here due to a schedule conflict, but I will say after a 34-year career in the news media, I saw the error of my ways and I joined the city of Dixon as the administrator to the mayor 16 months ago. The packet that was handed out to you came from me with some statistics from the Dixon County municipal elections. It also contains a letter from Mayor Weiss opposing the measure to change and a resolution passed by the Dixon City Council opposing the two bills that were amended after the fact very late in the session and referred to this committee for study. We also included in the packet some statistics from Dixon County elections. We have 6 municipalities in Dixon County. 5 of them chose to change their election after the General Assembly gave them that option in 2010. The city of Dixon chose not to. And of course, the city of Dixon is the largest municipality in Dixon County. And one of the reasons that they chose not to, we hear a lot about voter confusion when you add city elections to county or state or federal elections on the same ballot. Imagine a city election being after all the yes-no retention votes on a ballot that most voters just glass over when they see. But we have a unique situation in Dixon and Dixon County. Our city and county have the same name. That doesn't happen that frequently across the state of Tennessee. Franklin is not in Franklin County. So people know the difference between their county and their city governments. In the 16 months I've been at Dixon City Hall, not a single day has passed that somebody hasn't called with a question about county services because they don't know the difference between the government of Dixon County and the city of Dixon because we have the same name. They Google Dixon City Hall and they get us. So we have a unique issue in that voter education is an issue that we're dealing with when it comes to combining the ballots. Imagine a ballot that has the Dixon County mayor and the city of Dixon mayor both on them. There are also issues that we are a split House district. We have one voting district where our voting districts do not correspond to our city wards. The city of Dixon has 4 wards. All the others are at large. But we have one district that is actually split by the House of Representatives and has residents inside and outside a municipality. So that district would have to have 4 ballots available to voters coming to that precinct. So that can cause confusion. Of the 5 municipalities that have changed their election since 2010, all of them reported in the first 2 or 3 elections they had incorrect ballots provided to voters. The poll workers were not aware that they were in the city or out of the city, and some of these mistakes were not caught until after the ballot was cast. So it could not be corrected. So voters were denied the right to vote in a municipal election because they were not given the right ballot. We also have 2 municipalities that have property rights voting, which further complicates things. I showed you the statistics for the 5 largest cities. Sladen, our smallest municipality, I didn't include that because they haven't had an opposed race in my lifetime for mayor or their city council. In fact, most elections, they don't have enough candidates on the ballot to fill their positions. So I didn't include their statistics. But if you look at them, of the 4 cities that I've listed that did change their election, you do not see a pattern of increased voter turnout. You see some elections that did have more voters turn out after they changed. You see some that didn't. I think it's more ballot driven. That's why I've given you a description of each ballot, how many opposed races, how many candidates, and whether there was a referendum on them. Election turnout is ballot driven, not date driven. I don't think the people care when they vote. They care who they're voting for and what they're voting on. So I think that's what drives people to the polls. And the high point for me in the legislation from 2010 was the fact, in their wisdom, the General Assembly allowed cities that did change the chance to go back. You have one opportunity to change back to your election cycle that's established in your charter standalone by ordinance, by not having to go through any charter change. So even at that time, I think the General Assembly realized this will not work for all cities. What works for Chattanooga or Franklin or Harriman or Parker's Crossroads and Dixon may not be the same. It depends. Our election administrator told me just yesterday she opposes the city of Dixon changing its election. She thinks there would be too many problems with the confusion. She thinks that it would be problems to educate her poll workers. Quite frankly, because elections are held during the day, poll workers tend to be older Americans who are retired or don't have jobs. She said that sometimes that can lead to problems in educating. She thinks there would be additional cost in education and advertisement to keep voters straight. She also gave me an estimate. The last two elections, the city of Dixon standalone cost $9,200 and under $12,000. Her estimate, if we move to a corresponding election in August or November, would be our cost would be $6,000. So you're talking less than $6,000 out of a $24 million budget. That's less than 25 thousandths of a percent or 1/7 of the penny of the tax rate in the city of Dixon. So cost is not a driving factor. Turnout has not seemed to be that affected, at least in Dixon County. I respect what Mr. Goins said, but in Dixon County, if you look at the statistics I gave you, and I didn't give you a percentage, I gave you a raw number of voters that went to the polls. And while some elections have seen more, some have not. It all depends on who's running for mayor most of the time. In the city of Dixon, we've not had an opposed mayor's race since 1995. So when we have a ballot with an unopposed mayor's race and only 4 candidates for 4 council positions, you're not going to see turnout whenever you put the election. But the city of Dixon and the city council has respectfully asked to be given the right to make local decisions by the people elected locally to represent the citizens of their city. Thank you very much.
Well, thank you for inviting me, and it's I'm Philip Warren. There we go. I'm Philip Warren, Administrator of Relations in Wilson County. So my perspective, Coordinator Goins, I think, covered most of my perspective is going to be more on a local level and how your administrators in the counties would react to this and how they would impact them. You know, it's not just municipalities that have standalone elections. Gibson County's got 6 school boards that hold individual elections. Senator Yeager, Representative Wargu worked with the Tennessee Association of County Election Officials this year to help cut those costs because they do have elections where the ballot didn't full. And now they don't have to do early voting in those standalones. So it's not just municipalities that cost, it's also school boards that could be impacted by that. Wilson County has three cities. We've got Lebanon, Mount Juliet, and Watertown. All 3 of those, Lebanon being the last, have consolidated their elections with the November general election, the federal and state general election, and all 3 of those every 2 years has an election. So we're all consolidated. Lebanon was the last it did it in 2008. They had to extend a term a year for the mayor to do that, and that's when they started not holding it an off year. Give you an example. In 2014, Lebanon held a sales tax election, standalone sales tax election in September, right after the August election. The cost for that was about $20,000, and of the 16,000 registered voters, they had 1,450 showed up for that election, 8.93%. In November, there was a city election. They had the mayor was not on the ballot. It was just 3. The councilmen were the only thing on the ballot. So just to contrast the two, the 2014 election, the November election, right after that 8.93% turnout and 1,450 people, there were 3,180 voted in that city election that was combined with the regular election in November. So we did see a significant increase in voter turnout. It's almost doubled between those two, you know, in that year. So that's a good example of that, I think. We talked about the ballot and how many splits. Our county has 2 House districts, 3 cities, a school board, special school board that consists of the old civil districts that doesn't even match a city line anymore. So we have a lot of splits in our county, and a lot of people. We're right at 80,000 eligible voters in the county. So I'd say it's a mid-sized county. But a voter can't skip a race. The down ballot, we're talking about 2014. That's when we had all those constitutional amendments on the ballot. So the city election was at the end of that and still had a double turnout on that. But you can't skip a ballot, and I think every county in the state has the same type of a system. Whatever voting systems they use, they're set up where you have to look, where the voter has to look at every page of that ballot, be it paper, be it a DRE, whatever system there are, they have to look at all those races. So you can't skip it. You may not vote on it, but you have to look at it all the way down through there. So ballot fatigue, we see people that come in, they don't vote for president, they just vote for the mayor of the city. They don't vote for governor, they just vote for property assessor or tax, the trustee. So people vote for different things. They don't vote for everything on the ballot every time, and because they don't know something about everything on the ballot every time. I think the majority of voters make informed decisions. There are those that, like you said, show up late. We had somebody, said they knew about early voting, they knew about election day, and they came 2 days later and wanted to know if they could late vote. So, there are those people. Yeah. We told him, unfortunately, he couldn't. The advantage of being listed first on the ballot or having the content, by name, having your name as A, or being in the middle or the last of the ballot is I don't think as strong as maybe it's intended to be or it's talked about being. We see a lot of people with the last name starts with a Z that get elected, or with Y. And there are people with A's that don't get elected. So I think that's more of it's a story, it's told more than it is. Most voters are informed voters is what we see. In 2012, we had a special school district election in our county. We have one every 2 years for a board seat. That election was won on election day by 7 votes. We had a contest of that election. And they said, there's 7 votes, and so, they went to court right after the election during the contest period, and the judge said, you're going to have another election, because there were questions about whether they got the right ballot or not. Now, we've changed the way our ballot system works now, where they actually have a printed ballot, and they can see the names of who they vote for before they cast now. So there's really it puts some responsibility on the voter to look at and say, oh, yeah, I got the right ballot, and that's the person I wanted to vote for. So it kind of takes the responsibility, puts it over to the voter who needs to pay attention when they do it. But then in 2012, we didn't. The beauty of that was that we could turn around in November and have that election. That wasn't a special election. It didn't cost the school district anything. It didn't cost the cities anything. It didn't cost the county anymore. We just put it right onto that election. And actually, it turned around and then won by 7 votes again, or very close for the other candidate. But that's an advantage of having it in that same time period. It didn't cost anybody anything else. From an administrative standpoint, holding the municipal elections in conjunction with federal, state, local elections, it does save a lot of work. We have one set of training for our poll workers. We do train before every election. So you train them one time or you recruit them one time. Supplies, the cost of just the election alone is not increased because it's all combined. And like I said, the ballot size has not been significant, has made a significant change on anything. It's worked well in Wilson County. Like I said, my perspective is on the county, and that's what I wanted to give you, is how it works on a local level. Your counties are larger or smaller, or we've got 95 very diverse counties in this state, and this is what fits Wilson County and works well. But as Coordinator Goins said, it may not fit all counties. Thank you.
Mr. Goins, thanks for being with us today. Was there a physical note on this bill?
There was, and so it was an amendment. So the bill started out something different, and the amendment came in, and honestly, I don't know what that physical note is. I can't recall if they amended the physical note or not, based on the original bill.
All right, that'd be interesting for us to know, because if it's going to cost the state more to force these cities to change, doesn't make sense to me. The idea has been expressed by a couple of folks here that the law exists to allow for those cities that want to do this. I just have to echo what was said. I think it is important for, there's so much preemption on municipalities now. People who have not sat in local government seats telling local government how to run their business has made our jobs harder, not easier. And there are fiscal notes to us for these things. So I'm very concerned about the preemption in general, but specifically here, because as I said, if it's going to cost the state anything, why would you do it? Why the law already allows those locals to do it, and if it's not affecting what the state does, why would the state legislators get into it?
Yeah, I think it would be a cost savings as opposed to a cost increase. The only counties that I can recall thinking it could be a cost increase, once again, would be a larger municipality where you've already got a tremendous amount of ballot styles, and they would be concerned that they might have to open up a different precinct, or just if the printing of additional ballots or setting up the machines, the cost there.
Well, I understand that locally it's a cost, but to the state, I don't know how much more cost it would be or less cost it would be, since that cost is borne by the locals.
Right. And we did not purposely touch the preemption because I think that is a policy decision that is way out of our authority and purview.
Thank you.
Thank you, Mr. Chairman. Looking up the bill itself in the original form, the fiscal note was non-significant. After the amendment, the fiscal note did decrease local expenditures by over $100,000. So to your point, you're right, it would not be an expense to the state, but to the locals, there would be a significant savings.
I guess, Mayor Littlefield, I heard what you said about representative government. And I suspect all of us would agree that when we have a representative government, one of the most important functions we do is determining the manner in which we select those to whom we grant the ability to govern us. Given the importance of that, why shouldn't that be as local as it can be? That is one of the most important, to me, one of the most important things we do as citizens. So why do we need Nashville to tell us how to do that? Why can't the citizens of each municipality decide, here's how we wish to do it, here's how we wish to engage in this most significant and important act as a citizen, even if it costs us money, even if others may look at it and say, that's silly. All these decisions about ballot fatigue and cost, they exist in every instance. But what I'm curious is why we wouldn't acknowledge that of all the things that we do, why shouldn't this one be local?
Well, let me say, first of all, that I'm not a big fan of preemption either, as my friend Representative Carter would acknowledge, and think that there have been far too many state acts recently, to point the finger at the legislature, that have taken away initiatives from local elected officials, which I think are unfortunate, but I've been around long enough to know that what goes around comes around. These things will pass on. I remember the debate and discussion about whether or not we should allow early voting. And I remember a lot of my Democratic friends were for it. A lot of my Republican friends were against it. Now we've had experience with early voting for quite some time. I think you'd have a hard time going back to what we had before then. And I think probably the Republicans who serve in those positions now would oppose going back to the 1 day of ballot. I don't really see this idea as a serious preemption. I just see it as the state setting a realistic standard for when elections should be held and calling everybody to vote at the same time. People have a right to vote any way they want to vote. But I have discussed this issue in the past with my now deceased friend, Gene Roberts, who was absolutely a card-carrying Republican. And I said, you know, I think we all ought to vote at the same time as the national elections because more people would come out. And he said the same thing you've heard here. Well, it'd just get lost on the ballot. People, you know, wouldn't know who they're voting for, all of the things that we're still talking about today. But I just really don't see having people come knowing that it's voting day and sitting down with the ballot before them. And I know that, you know, that we have all these ways of dividing ourselves. We've got all these political boundaries that we have to consider. We've got school board races. We've got county commission races. We've got all of that same thing in Hamilton County. And I think throwing Chattanooga in there would not inordinately complicate things. We have computers now. And I know that in the offices of election administrators, they can go through and they can click a box here and there about, and I'm always amazed, frankly, but I know that it's not rocket science with computers to go in. I go in, I vote early. They hand me a ballot that has all of my decisions on that ballot, even though that I'm at a central election point because it's printed out by the computer. Now, if I take issue with it, I'll go back and question it. But I don't think that's a problem. But back to your point, and I apologize for wandering off, but that's what we do when we get into politics. We go off on rabbit trails. I don't see this issue as one of those preemptions that I've not been in favor of recently. I just see this as setting a basic standard statewide for when we will hold elections, and then everyone can go forward from there.
So would you, if we set that standard, should it apply to counties and that we eliminate the May primary, which typically has low turnout, and we only have elections in August and November? Or would you simply say we're going to only apply, we're just going to pick on the cities and apply this to them?
Well, I've had the privilege of only serving in nonpartisan positions, which is why I could be a true independent. And in my administration, I had card-carrying Republicans and Democrats who worked in my office, and we all got along famously. If the parties, as they are now constituted, continue and they want to have primaries, I say let them have primaries and let them pay for it. But whether or not you have a primary, in my opinion, is not an issue when you get to the general election. I think when you're making those choices, and that's what municipal elections that I was always involved in were, we didn't have a primary. We got to the election, we voted for whoever was on the ballot at that point, and let the chips fall where they may. But I really can't respond all that knowledgeably about how it would affect a primary, except to say that, you know, I think the whole party system is changing dramatically now, and so there might be some changes somewhere down the road. But the question before us is, you know, should we have general elections or municipal elections at the same time as other general elections? And I've studied it for years, I've discussed it, I've debated it with people on both sides of the aisle, and my opinion hasn't changed in a couple of decades.
Yeah, and I'll share with you that we hold our municipal election in November because we made the decision locally that we wanted to have our election with most likely greater turnout, and we took advantage of the cost efficiencies.
Right.
And so I understand the reasons why you would do that, but as I approach things, and I'm a core value hierarchy kind of guy, and while I appreciate the why the decisions could be what they were at the local level. It seems to me that the most important thing, more important than the cost, more important than do voters really know what's going on. Those are all very important, and we need a lot of people to vote, and we would hope they're informed when they vote, is where are we going to make the decision? And I would think that if we decide that we want the most important decisions to be made closest to home, that this is a prime example where we would do that. But if we go down that hole, right, we decide we're going to start dictating when elections occur on uniform dates across the state. I'll share with you what, and this is absolutely non-scientific, but I did Tuesday what I do every election day, and I stood outside, visited the various precincts, and shook hands, and says, tell me how things are going, and it's amazing what you learn. The things you think are important aren't really that important. The things you didn't know about are really important to people. And I had at least 20 people say, Mayor, how come we have so many elections? Why can't we just do this twice? And, when that's what my folks are saying, the idea that maybe we ought to be thinking about them and the convenience to them ought to come into play. But what I told them was, we have to just do what's best. And, but it's not, as much as I believe we have to have local control, and maybe one of the things this report can do is provide data for the cities that make these decisions so that they can be better informed of whether they want to have multiple elections or not. But it is an issue, because that maybe was the most common question was, some of them it wasn't, why do we have, a lot of times it was, we have too many elections. I don't understand why I can't come in August and November and vote on everything. But I appreciate you all's patience with me.
If I could just respond briefly to that. In my opinion, and if I could go back and have another term or so as mayor, and I have no desire to do so, because I'd have to go find another wife. But I would take on the issue of moving Chattanooga's election to the time of a general election. In fact, sort of late in my 2 terms as mayor, a woman on the council who was absolutely, and she wouldn't object if I said so, she was a Tea Party, very right-wing person, and she came to see me and she was upset and said, why don't we have elections at the same time as general elections? And I said, well, I'm for that. And she was shocked that I was for that. And I said, but it's a complicated issue. When you get into it, there's going to be a lot of debate and discussion and so forth, and people are going to come out with all kinds of reasons for not doing it or for doing it and other ideas and such. I think the reason that we are where we are right now with these elections set out by themselves is simply because people can't muster the time and sometimes the political will. And Mr. Mayor, there are always lots of things on your agenda. And changing something like the time of an election might sound simple, but you get into either extending terms, or courts have said you can't cut terms short. So it becomes very complicated. And I've been through some transitions in Chattanooga, and they seem simple looking back, but I've gone back through some old records lately and just laughed at some of the reasons people came out with for why we couldn't do things. It was amazing. And I think that that's really what we're faced with today. There's an inertia, a political inertia, just having the system that we have right now. And just like before we had early voting and so forth, it seems scary looking at it, but I think once you get beyond it, it's not that big a deal, and people say, why didn't we do it before?
Recognize Senator Yarborough and then Representative Worker.
Thank you, Mr. Chair. Can you remind me, when did we make the change to let municipalities move the election date?
So it got easier under the law in 2010. As she stated, I think 2008, someone may have done that in Williamson County. So they could have changed their charter before then, but essentially permissive, less complex process, 2010.
And how many have done that at this point?
So we have notice of 23. There may be
Of
more.
total?
23, we have 71 that have not.
So, I mean, I think that speaks a little bit against the inertia point because, I mean, something that's been available for just a decades got close to a, call it a 25% adoption rate. I mean, this is fascinating and, can pull you all the different ways. I mean, I think Mayor Biggers makes a good point that if what we cared, you spoke about turnout earlier, if we cared primarily about turnout, we would move county, state, and local all to November with federal, and we'd have one election then and primaries before it. But there's other issues that come into play. I think Mayor Bergen mentioned several of those, from the type of conversation you're having to the informed electorate, like how easy it is for people to actually communicate with people. And at some level, we're just fighting over what democracy is and what it should look like. And I mean, I've worked hard on turnout issues, but I think we've all worked hard on, issues that relate to other things too. And I guess just part of this is there a competition effect that goes on right now in terms of cities get to move and see what happens to their local government, and we're seeing that start to happen. Frankly, that'll keep going to, as one group of cities does one thing, one group of cities does the other, and people will be able to evaluate that. And it strikes me that the Constitution may actually sort of lead us in that direction, in that, the Constitution is super specific about when elections for the General Assembly are. Like, it is the first Tuesday after the first Monday in November. There's a whole article about elections, and that just says these are going to be, you have to be, if you're eligible to vote in the state, you have to be eligible to vote locally. The state can pass laws to make it safe and secure, the purity of the ballot box and so forth. And I mean, I guess to me this ends up being a question about who gets to decide like what democracy looks like, and do we do that at a state level, or is that itself something that is to be kind of fought out in the public arena? I know that's sort of an abstract question, but I think that's where we are. I mean, what we're talking about here is, how do we structure these decisions, and is it more important for there to be turnout, more important for there to be knowledgeable voters, more important for there to be focused on a few races or not, the partisanship overlay or not, all those things that come into play. And I guess how do we evaluate whether this is working in 10 years? Like, I mean, in one place, because doesn't the evaluating whether it's working just require us to look at sort of these abstract principles? I guess what measures would we look at to say this is a good thing? And I'll leave that open to anyone because it's kind of broad.
If I may respond, and I'm the least qualified, I've never run for office or taken part in coordinating any elections, but I've covered them for over 30 years and been involved in the election process. I think the bottom line is we want to encourage more people to vote. Whether this issue is who decides, but I think the motivation is not enough people are taking part in the voting process. And I don't think the election date is going to change that. I think the way we vote is what we need to look at. I think the greatest thing we've done was change the early voting. Went from absentee to open early voting. I think that has impacted. This past session, there was a bill to lift restrictions on absentee voting. I believe it died, but absentee voting was going to be offered open to anyone without the restrictions normally applied. Some states are now doing day of registration. You can continue to register up to the time you vote. That is in process, and they have seen dramatic increases in turnout. Some states are now experimenting, and of course security is an issue, with online voting. I think the issue is you want more people to vote, you have to change and make it easier for people to vote, not decide what day they're going to vote. Extend the early voting periods, lift restrictions on absentee voting, and extend the registration period. I think the more you get the information out to people and the easier you make it to vote, the more likely you're to see an increase in turnout, which I think is what we're trying to do. We talked about the miserable percentages in municipal elections, but we didn't talk about the percentages in county elections. In Dixon County, I know they're barely above 50% on hotly contested races. The off election year, where we don't have the county mayor, where it's the assessor, we see a much lower turnout. So it's ballot driven, not date driven, in my opinion.
So if it were me and I were looking at this, I think I would look at both. I would look at the 71 that have not and ask those cities, why haven't you done that? It's a, it's a survey of the councilman, the alderman. Look at the turnout of those 71, look at the cost. Look at the 23 that have, why did you do it? And then once again, what are you hearing in the community when you're out there talking to voters? What has been the cost savings and what has been the turnout? And then one thing not to get lost in this is the competitiveness of the races. When you have no one running, and that's what Senator Yeager and Chairman Wergo certainly saw, when you have no one running, then you shouldn't have early voting because it's a foregone conclusion. But why is it you have no one running? Is it because it's a standalone election? In other words, do you have more candidates in a standalone election versus if there's someone on, for an August or November? And I think you need to look at all of those, because all of those are a part of, I guess, democracy when you look at it. It's not just cost savings, it's also looking at competitive of races. And you did get it. I mean, if you give the people some reason to go out and vote, they're going to go out and vote. But a lot of the low turnout races, I mean, when you have 5 individuals turning out to vote, no one's running. Now, it may be folks are happy with their government. It may have nothing to do with the date. But I think all 3 of those are factors to look into. And that's what I would look into if I were looking into this.
In my opinion, this isn't really... Thank you. This is not a question of the results. I think this is a question about intent. I do think... Is the red light on? Okay. Does red mean on or off? Thank you. I do think this is a philosophical question, because this right for cities to change exists currently. They can do this already if they want to. So if this measure passes, you will effectively be taking away whatever rights cities are granted from the state legislature. You'll be taking away one of those rights. So if you're talking about representation, I think that the cities that have in effect voted, if we're going to get metaphorical about it, and made their decisions already. So to me, it already exists. If they want to do it, they can.
Thank you, Chairman. Welcome to the legislative. This is exactly some of the types of conversations that take place within the hallways and in these exact committee meetings that we're hearing today. I think the reason why we're here today is because my counterpart in the Senate, Senator Yeager, along with myself and other committee members, were torn with the decisions of where do we go from here. I think our objective is to protect the locals as much as we can protect them and give them the abilities and the fluctuation to do what they want to do to a point. But it's also easy to point the finger at folks when they say, well, them boys up there in Nashville, they're the ones that are making these decisions. And we'll often do that. And we'll often hear at the state level say, well, them boys in Washington are mandating to us of what we should do and what we should not do. and welcome to the political arena. The very reason why we're sitting here today, starting this process, is because one of the most talked about topics is follow the money. It's all about the money. And these people that are running up and down the hallways and spending time in our offices convincing us to go one way and on one day and another way on another day and then another way on another topic, and you're in and out, and you want to have that open door policy and you want to listen to them. Maybe if we close that door and just listen to our folks back home, it might be a little bit easier. Maybe not. But all about the money. And so we hear from locals, well, we need money for this, and we need money for that, and this costs this, and this costs that. So we up here trying to pass a balanced budget, trying to decipher, well, if I see a fiscal note that's going to save our locals over $100,000, but yet we put mandates onto them that is going to cost them $50,000 or $60,000. Well, maybe at the end of the day, we did end up saving them a little bit of money either way. But some would say, well, let us decide how to spend that money, but give us all the money that we want. And so that's the decisions that we sit here and that we're faced with on a daily basis during the session. And again, it's easy to blame those legislators for the things that you want to blame them for, and it's easy for us to take credit for the things that we want to take credit for. And again, welcome to the political arena. When in reality, we should be out there doing the best that we can to make the state of Tennessee the greatest state in the country to live and the most affordable, all at making great decisions and allowing those decisions to be made at the level where they need to be made. Sometimes we find ourselves here where we have no options, absolutely no options, but to make decisions because people have come into our hallways and they brought a piece of legislation from an idea from a constituent or a county commissioner or a city mayor or a county mayor back home, and they want us to make that decision for them. But then they have legislation that they don't want us to touch and not have any input at all. Welcome to the political arena. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Perhaps I have a Will Rogers moment or a Pollyanna moment on this. But it seems to me, regardless of whether we're going to have a savings of monies or we're going to have gather more people to vote, the real issue, I think, and intent of most of this is, are we going to have educated voters who really understand why they're voting and who are motivated to come out and vote? And so for me, leaving it at the local level is a very important reason, not for autonomy, not for finger pointing at the legislature, but more for understanding their particular electorate. And in our case, if it's a separate election, it doesn't get caught up in the huge other ballots with 24 other pages. It actually gives us time to learn who our candidates are, what they're about, and more than the candidates, the issues that they're addressing. And I think that gets lost when you try to pile everything together. And so that's probably one of our concerns. But the most important thing to me right now, it's a philosophical thing, and that is, can the voters find time to become educated? Can they take the time to interact with the candidates to be able to know who to vote for and therefore be motivated to vote? Thank you.
To that end, let me just throw in, Dixon City Hall had 3 calls Tuesday wanting to know where to vote for the transit referendum.
Any further questions? Okay, hearing none. Thank you all very much.
Yeah, excellent, excellent, excellent.
Good presentation. Thank you.
Mr. Chairman,
Yes.
I just have one comment about the election process. I don't know if you all realize it, but 3 days ago we had a milestone, and it was 40 years ago in 1978 that the position of county mayor was established and had the first election. Now, that was 40 years ago in 1978. Many fantastic women and men have held that position over the years and still do today. But there is only one that I know of that came in 1978 and has held that position for all 40 years, which just goes to prove the point that you can indeed fool most of the people all of the time. Mr. Chairman, congratulations on reaching that milestone.
Thank you. Mr. McMahon, I was about to call you out of order on that. That tells exactly how old I am, because you know what the minimum age is.
Yes,
and you can add 40 to it.
I just want to add that right before he ran for public office in 1978, he did teach elementary school in Cock County for 1 year. And he's kept this job all this time just so he wouldn't have to go back to teaching in Cock County.
Okay.
Thank you, Mr. Chairman.
We're going to move on now. The next item is multiple school system study it's Senate Joint Resolution 593. We're getting an update by Mr. Kaiser.
Thank you for having me. Good morning, Mr. Chairman and Commission members. Today I will be presenting a brief update on the study directed to TACIR by Senate Joint Resolution 593 by Senator Hale to study the overall effects on public K-12 education of the laws and regulations related to the sharing of resources and operation of multiple school systems located in the same county. A hard copy of the memo, along with attachments, has been provided for your review under tab 9. Please take a look at Attachments A, which is a table of school systems by county in Tennessee, and Attachment B, which is a map of these systems. There are currently 141 school systems in Tennessee, and 28 counties have more than one school system. There are 14 special school districts, which have the authority to levy a property tax, and 33 city school systems, and 94 county school systems. Gibson County is the lone exception there. To be clear, this study will not include the state special schools, the Tennessee School for the Blind, the Tennessee School for the Deaf, and the West Tennessee School for the Deaf, or the Alvin C. York Institute, because they don't receive local revenue, nor will include the Achievement School District or the State Board of Education School District, because they are funded by the school systems from which their students come. Now I'll draw your attention to the first two revenue sources shown in Attachment C, which is from a 2005 TACIR staff report. Based on our understanding of current state law and preliminary conversations with stakeholders, in general, county property tax revenue that is used for education operations and maintenance must be shared among all school systems in that county based on each system's share of the county-wide student count weighted according to grade levels and programs, such as special education and vocational. That is, each system's share of the weighted full-time equivalent average daily attendance. In contrast, state law does not require revenue from property taxes levied by a city that is used for education to be shared, nor does it require revenue from property taxes levied by a special school district to be shared. The sharing requirements for local option sales tax revenues are shown in the middle row of Attachment C and are discussed in more detail in Attachment E, which is a research brief provided by the County Technical Assistance Service, or CTAS. Under state law, half of all local option sales tax revenue, regardless of whether it's collected in a city or county, is required to be used for education and must be shared among all school systems in the county based on each system's share of the weighted full-time equivalent average daily attendance. The other half of the local option sales tax revenue is distributed to county or city governments based on where the sale occurred. Any of the county's portion that is subsequently used for education, operation, and maintenance must then be shared among all school systems in the county, but the city's portion does not. The treatment of revenue from state shared taxes varies by tax, though in general, as shown in the bottom row in the attachment C, staff's past research has found that as of 2005, some of the laws have changed since then, there were no sharing requirements for revenue from state shared taxes used for education. However, there are some exceptions to this, as described in a CTAS research brief on mixed drink tax, which is found in attachment F. Staff will be conducting additional research on state share taxes pursuant to this study outlined behind tab K, as you heard in yesterday's discussion in the work program, and we'll incorporate those findings from that study into the study directed by Senate Joint Resolution 593. Revenue from bonds issued to fund education-related capital improvements are also subject to sharing requirements under state law, as described in a CTAS brief found in attachment D. In general, revenue from bonds issued by counties for education-related capital improvements must be shared among all school systems in the county based on each system's share of the weighted full-time equivalent average daily attendance. While state law has no such sharing requirements for revenue from bonds issued by cities for education-related capital improvements. There are some exceptions to the sharing requirements I've just discussed. For example, according to a 2014 ruling from the Tennessee Court of Appeals in Knoxville, the Athens Board of Education versus McMinn County, county revenues from property taxes and local option sales taxes that are transferred from the county's general fund to a capital expense fund can be used for education-related capital improvements without being shared among all systems in the county. Moreover, as described in the CTES brief on bonds in attachment D and discussions with local school finance officers, revenues from bonds issued by counties for county-related capital improvements are not required to be shared if a tax district is established so the school bonds are payable only from funds collected outside the city or special school districts in the county, as long as the money is being spent on school buildings that serve grade levels the city's school system or the special school districts do not serve. And that's based on a 1963 case, the Board of Education, City of Athens versus McMinn County. This is information that we have gathered to date, and I'd just like to open up for questions.
Okay. Question? Yes, Mike.
It's interesting. I dug out my 2005 study, and I brought it. It's in my briefcase. It's kind of dusty, but since 1998, I've served on 4 different educational task forces, and went through a federal court process to establish our own schools after the state allowed us to go back to what our original charter says, which said we had the right to educate our children. And the federal judge agreed that we had that right, and we passed those taxes on the basis of our local needs for the local schools. Those are not paid necessarily by people from outside. However, some of them are. But we'd be hard-pressed on the half-cent sales tax to say where that money, who's bringing that money to us to spend, depending upon where you're located. And you're going to get some some crossover. You know, we have people who, you know, I told you my wife's age, and I'm going to tell you she shops across the street in Memphis sometimes, and, you know, I'm big on buy local, so I'll get in trouble that way too, while I'm at it. So, you know, you do have crossover of spending. Memphis chose not to have that tax to go towards educating their children in some form at this point. So I just want to be sure that as we look at those bonds, they are specifically paid for instance, particularly a GO bond, that's going to be paid for out of property taxes on those people who live in that city and agreed to in the referendums that we held to have the schools, to us spending that money, whether they had children or not, on the education of children. So I just want to be sure we're focused on that as well. Thank you.
Thank you.
Well, go ahead.
And I just want to echo one of the points that Dave made, which is that we see considerable overlap between this study and the tax study that was expanded upon yesterday, especially now that study's gotten more comprehensive. And we'll actually be using a lot of the information we gather for that tax study, and will feed into and help inform this study as we start to take it up. And because of that, a lot of the same research staff that's working on, that we had planned to work on the education studies, also being shifted to work on the tax study, so we can kind of retain that information as we gather it.
Okay. Other comments? I just have one comment, and that is right after I took office back, it's been noted back in 1978, we had a city in the county that said they were going to, we just have one school system, said they were going to create their own school district. So I called the mayor up and I said, that's fine. I said, I tell you, I'm going to make you a deal. What we're going to do is we're going to give you the county school system to operate. You can be the czar of education in the county. You can pay for the county schools, and you'll have more employees and more buildings than you could ever imagine. And I never heard another word from him after that. But other questions? Thank you very much.
Thank you.
Okay, I think we're down now to other business, and the only thing I would say is, and I don't know if this is going to be an issue for anyone else, but we have set the August 28th and 29th meeting, and for some of us in there, hopefully that's moving toward a new swearing-in ceremony for local officials on that date. So I mean, I don't know if anybody else has the issue. I know Jeff did. I do at that date. Yeah. I can't, and I don't know. That may not be enough folks that have a conflict to make a change, but I just note that the 28th and 29th would be difficult to do.
Mr. Chairman, would the 21st and 22nd work better? No? No?
You know, we talked about moving it to the September week, and that was a issue as well for some that might be going out of town. I think we talked about the 6th and 7th, or 5th and 6th, or one of them, didn't we, Cliff?
What about the end of August, that last week?
Yeah, that's where we're at
right now. You mean the 30th, 31st?
Yes.
Actually, I think it's when we're actually swearing in. It's too close to
Yeah.
Labor
Day.
Yeah.
What about the first week of September, toward the last of the week?
Is it the 6th or 6th and 7th?
Yeah, the 6th or 7th.
Some of us may not be back.
Well, I've got an opponent too. That's always a possibility. That's always a possibility. We'll have to roll the dice on that, Kenny.
I'm good.
Yeah. Yeah. Is 6th and 7th
Is that good?
okay?
Is that good?
If it's all right, then Cliff, we'll change it to September the 6th and 7th.
Mr. Chairman, I have one other.
Yeah, go ahead, Cliff.
Just one other small item of other business, and this was the issue came up yesterday. Chairman Norris made a request for information on our website statistics, and I'm just going to pass that out to the members now. This is limited in that it only shows hits on our website since the new system, the new state system came on. Oh, thank you, April. Came on in December, but it breaks it out by category of our webpage and shows that, not surprisingly, the publication sections and the commission sections are most popular with a little bit over 2,000 unique hits. And I believe these are unique hits from outside our own, so I don't think it's just TACIR staff sitting around and TACIR members sitting around hitting the site. So I think these are external hits on those sites. But just for your information, and April's passing out. Thank you, Mr. Chairman.
Okay, thank you. Any other business to come before the commission?
Do you want to address December while you're talking about dates, or is it too early?
I don't know. You want to wait? Probably best just to wait till the September meeting. That way folks will have their yeah, see who's here and who's not here. That's a positive thought right there. Anything else to come before the commission? Do we have a motion to adjourn?
So moved, Mr. Chairman.
Do we have a second?
Second.
We have a second. All in favor of adjourning, please rise. We're adjourned.